High blood pressure has been called the silent killer for one terrifying reason. It gives you almost no warning before it strikes. No pain, no alarm, no obvious sign, until the day it causes a stroke, a heart attack, or permanent kidney damage. But here is what most doctors don't have time to tell you. Your body is sending you warning signals. They are just incredibly easy to miss or dismiss as something else entirely. Today I am going to show you all 8 of them. Pay close attention, because recognizing even one of these symptoms could save your life. If you care about your health and the health of someone you love, subscribe right now and hit the bell so you never miss a life-saving video. Now, high blood pressure or hypertension is one of the most common and most dangerous conditions affecting seniors over 60. According to the American Heart Association, nearly 75% of adults over the age of 60 have high blood pressure. 75%. That means if you are watching this video, there is a very strong chance this affects you directly, or someone you love. And yet, most seniors with high blood pressure have no idea they have it, because it causes almost no obvious symptoms in the early stages. That is why it earns the name silent killer. But the word silent is not completely accurate, because your body does send signals. Easy to explain away, easy to ignore, until they aren't. Let's go through all 8, one by one. Red circle symptom number 8, frequent headaches, especially in the morning. And we are starting here because this is the one most seniors dismiss without a second thought. Frequent headaches, especially the ones that are there when you first wake up in the morning. Most people blame poor sleep, dehydration, stress. But what many seniors do not realize is that a sudden increase in headache frequency, particularly at the back of the head or behind the eyes, is one of the body's earliest warning signals that blood pressure is elevated. When blood pressure rises, it increases pressure on the blood vessels inside the skull. That pressure manifests as pain. If you are waking up with headaches more than 2 or 3 times per week, do not wait. Check your blood pressure that same morning. Track the readings and bring them to your doctor. Red circle symptom number 7, blurry or changing vision. Now, many seniors assume their vision is simply getting worse with age, and sometimes that is true. But here is what you must know. The eyes contain some of the most delicate and sensitive blood vessels in the entire human body, called the retinal blood vessels. When blood pressure is chronically elevated, these tiny vessels come under enormous strain. They can swell, leak, or in severe cases, burst. This causes blurry vision, seeing spots or floaters, sudden sensitivity to light, or a feeling that your vision is dimming at the edges. In severe cases, hypertensive retinopathy can lead to permanent vision loss. Any sudden or unexplained change in your vision should be treated as a medical emergency. Never wait to see if it improves on its own. Red circle symptom number 6, dizziness or feeling off balance. Now, dizziness in seniors can have many causes, but recurring episodes of lightheadedness, especially when standing up, turning your head, or during mild activity, are a red flag that blood pressure may be fluctuating dangerously. Hypertension can disrupt the flow of blood to the inner ear and cerebellum, the part of your brain that controls balance. The result? A spinning sensation, unsteadiness, a feeling that the room is moving when it is not. This is not just uncomfortable, it is dangerous. Dizziness from blood pressure issues dramatically increases the risk of falls in seniors, and a fall at 60 or older can have devastating consequences. If you experience recurring dizziness, please do not chalk it up to a. Symptom number 5, shortness of breath during light activity. Symptom number 5, finding yourself short of breath during activities that never used to wind you. Climbing one flight of stairs, walking to the mailbox, carrying light groceries. When blood pressure is chronically high, the heart is forced to work significantly harder to pump blood through increasingly stiff and resistant blood vessels. Over time, this causes the heart muscle to enlarge and weaken, a condition called hypertensive heart disease. The result is that even mild physical effort leaves the heart struggling to keep up, and you find yourself breathless, fatigued, and needing to stop and rest far sooner than before. Do not accept breathlessness as an inevitable part of aging. It is your heart asking for help. Please listen. Symptom number 4, nosebleeds, the surprise symptom warning. Symptom number 4, and this is the one that surprises almost everyone. Frequent nosebleeds. Most people think nosebleeds are caused by dry air, allergies, or accidentally bumping their nose. and often they are right. But recurrent nosebleeds, ones that happen without any obvious cause, can be a sign that blood pressure is dangerously elevated. The nasal passages contain extremely fragile blood vessels called capillaries. When blood pressure spikes suddenly, these tiny vessels can rupture, causing bleeding with no warning. This is especially common during what cardiologists call a hypertensive crisis, when blood pressure suddenly skyrockets above 180/120. If you have had more than 2 or 3 unexplained nosebleeds in a single month, this is not something to ignore. Check your blood pressure that same day. Symptom number 3, chest tightness or pressure. I want you to take this one especially seriously. Chest tightness, a feeling of pressure, heaviness, or squeezing in the chest, even when you are just sitting still. When blood pressure is consistently elevated, the arteries that supply blood to the heart itself, called the coronary arteries, begin to narrow and harden. This reduces blood flow to the heart muscle, causing a painful, pressure-like sensation called angina. Many seniors describe it as feeling like someone is sitting on their chest, or a tight band squeezing around their ribcage. This symptom is never something to wait and see about. Chest tightness combined with high blood pressure is a warning sign of imminent cardiac risk. Please call your doctor immediately or go to the emergency room if the feeling is sudden or severe. Symptom number 2, pounding or irregular heartbeat. Symptom number 2, noticing your heart pounding, fluttering, or beating irregularly. This is called palpitations, and while they can be caused by caffeine, stress, or anxiety, chronic palpitations in seniors are strongly associated with high blood pressure. Here's why. When blood pressure is elevated over a long period, the heart's electrical system becomes disrupted. The chambers of the heart begin to stretch under the increased workload, and this stretching interferes with the normal electrical signals that regulate heartbeat rhythm. The result is a heart that beats too fast, too hard, skips beats, or flutters erratically. In the most serious cases, this leads to a condition called atrial fibrillation, or AFib, which dramatically increases the risk of stroke. If you feel your heart racing or fluttering when you are at rest, please do not dismiss it as nerves. Get it checked. Today, red circle symptom number 1, fatigue and brain fog that won't go away, police garlight. And the number 1 most overlooked silent symptom of high blood pressure in seniors is persistent, unexplained fatigue combined with brain fog. Feeling tired even after a full night of sleep. Struggling to concentrate or find words. A heavy, clouded feeling in your mind that simply will not lift no matter how much you rest. This is the symptom that gets dismissed more than any other, because seniors are told that tiredness and mental slowness are simply part of getting older. They are not. When blood pressure is chronically elevated, blood flow to the brain is compromised. Oxygen and nutrients that your brain cells desperately need are not arriving efficiently. The result is exactly what you would expect, a brain that feels starved, slow, foggy, exhausted. Over time, untreated hypertension causing chronic reduced blood flow to the brain is one of the leading causes of vascular dementia, the second most common form of dementia after Alzheimer's. If you have been feeling this way, please take it seriously. A simple blood pressure reading could reveal the answer. What to do right now. So what do you do if you recognized yourself in one or more of those symptoms? Step 1. Check your blood pressure at home today. Home monitors are inexpensive and available at any pharmacy. Take 3 readings, morning, afternoon, and evening, and write them down. Step 2. A reading above 130/80 on multiple occasions means you need to speak with your doctor. Do not wait for your next scheduled appointment. Call tomorrow. Step 3. While you wait, begin making the lifestyle changes that are proven to lower blood pressure naturally. Reduce sodium. Walk 20 minutes every morning. Eat more leafy greens, berries, and potassium-rich foods. And step 4. Share this video with every senior you know. Because most people watching right now will recognize a symptom they have been silently living with for months. Real senior story. A viewer named Margaret, 71 years old from Florida, sent us this message. She said, "Dr. Ethan, I had been waking up with headaches every single morning for 4 months. I assumed it was my pillow. After watching your video, I checked my blood pressure. It was 168/104. My doctor said if I had waited another few months it could have caused a stroke. Thank you for saving my life." Margaret's story is not rare. It is happening right now. in homes across the country, to seniors who are experiencing these symptoms and have no idea what they mean. You now know what to look for. Use that knowledge. High blood pressure is not a life sentence. Caught early, it is manageable, treatable, and the damage it causes can be significantly slowed or even reversed. But only if you act. Do not wait for a heart attack to tell you your blood pressure was too high. Do not wait for a stroke to wish you had paid attention sooner. Your body has been trying to tell you something. Today, you finally know how to listen. Please share this video with every senior in your life. A parent, a neighbor, a friend. This information is too important to keep to yourself. Subscribe to Dr. Ethan Care for life-saving senior health information every single week. I'll see you in the next one. Stay healthy, stay informed, and take care of that incredible heart.